Hi, my name is Jacob. I'm clinical specialist for AlterG, makers of the anti-gravity treadmill. Thanks for joining me on this short video. I'd like to introduce you to some new equipment that patients and physical therapists are using in the clinic. Based on patented NASA technology, the anti-gravity treadmill allows patients to recover and athletes to perform like never before. Join me as I show you firsthand what leading hospitals and these top professional sports teams are using in their rehabilitation programs. Come on. Traditional body weight support uses either a harness or pull to accomplish unweighting or progressive loading. While providing treatment options to patients, both are not without their drawbacks. Harnesses allow for easy access to the lower extremities, so physical therapists can position their patients' feet during gait training. With patients supported, therapists can also focus on facilitation techniques without worrying about patients falling. The problem with harnesses, though, are that they tend to be cumbersome and are extremely uncomfortable. This usually cuts sessions short and also makes it difficult to get higher level athletes and patients in them willingly for training. With NASA's patented differential air pressure technology, the AlterG is able to address the challenges of providing an unweighting, progressive loading device for the whole spectrum of patients. Precise partial weight bearing, superior comfort, and the ability to maintain normal biomechanics makes differential air pressure a new alternative and the best possible choice for unweighting or progressive loading in rehabilitation and training today.
Let me tell you a little bit about the AlterG technology. Inside of the anti-gravity treadmill, we've got a blower in the very front. Combine that with our specially designed bag, and we've got an environment inside this chamber where the pressure is slightly greater than the outside atmospheric pressure. The lower body positive pressure inside this bag creates a gentle lifting force for anybody inside the AlterG. At NASA, they found that it only takes 1.1 psi to get up to 75% unweighting. That means a comfortable and safe environment for any AlterG user.
Differential air pressure allows for numerous advantages when compared to some of the other current body weight support options like a harness or pull. You could see from this table that the harness provides good unloading or unweighting from 100% all the way down to 60% body weight. Any lower and it gets more uncomfortable as you need to provide more support. The pull, on the other hand, does a great job from 50% and below. But if you only need to provide a minimal amount of unloading, it's very challenging to get that within a pull. With the AlterG, we cover the whole spectrum from 100% all the way down to 20% body weight in 1% increments. First of all, we can be much more precise. With the AlterG, you can start loading someone from as low as 20% of their body weight and increase in as small as 1% increments. This will allow for precise recording of progress and complete control of the loading progression for each user. Secondly, comfortable support with our patented AlterG shorts means longer sessions of rehab and training. This translates into greater motor learning for neurological patients or longer training sessions with less impact for athletes. In fact, users like the AlterG so much it's usually harder to get them off of the unit once they've been in one. Thirdly, differential air pressure allows for normal walking or running mechanics. This is critical when we think about specificity of training. In a pool, we have to consider the resistance of the water, and in a harness, we are dealing with lifting support that often changes the body's natural movement patterns. Studies with the AlterG show preserved muscle firing patterns in both walking and running, even at various levels of unweighting. Think of the AlterG as a progressive loading, early controlled loading device. Unweighting may not be a concept that is intuitive clinically, since most of the time we as therapists are trying to load someone and get them back to full weight bearing, not unload them. That being the case, the sooner we can get someone into closed kinetic chain, the more benefits those patients can derive from their treatment sessions. We could improve proprioceptive stimulation, we could increase muscle co-contraction, we could decrease muscle atrophy, we could help prevent bone demineralization that accompanies inactivity, and we can increase specificity of training with the normal mechanics inside the AlterG. Until differential air pressure, there was not a way to control lower extremity loading. Patients that were partial weight-bearing had to guesstimate what the appropriate load would be, and weight-bearing as tolerated patients just had to endure their symptoms until they were at full strength to prevent symptoms from recurring. With the AlterG anti-gravity treadmill, we have a newer and better way to load the lower extremities. For weight-bearing as tolerated patients, we can find out at what level patients are comfortable loading and start there. Then we can progress very systematically from that point forward. This can prevent the treatment plan from being too overly aggressive, helping patients to avoid setbacks, and to continue improving in a linear progression. In fact, patients don't even have to start the treadmill. They can do close kinetic chain activities, proprioceptive exercises, all taking advantage of the differential air pressure. If they have less pain, the hope is they can tolerate those activities longer. For patients that are required to be partial weight-bearing, the ability to measure weight-bearing in 1% increments allows the AlterG to provide a very specific environment that respects healing tissue, post-injury and post-surgery, and this will help patients adhere to the surgeon's weight-bearing protocol. Here's a list of some diagnoses that could benefit from rehab in the AlterG anti-gravity treadmill: total hip arthroplasty, hip arthroscopy, meniscectomy, meniscus repair, ACL reconstruction, Achilles reconstruction, stress fractures, plantar fasciitis, and many more. We've already discussed the benefits of the AlterG with orthopedic populations. Post-injury and post-surgery patients can benefit from early controlled loading and precise partial weight bearing. Now, I'd like to share some other potential applications of the anti-gravity treadmill for other clinical populations. Motor learning is at the heart of all neurological recovery programs, and one of the keys for motor learning is repetition or massed practice. Because of the superior comfort that comes with body weight support using differential air pressure, neurological patients can tolerate longer practice sessions. This will hopefully translate into better motor learning and more successful outcomes. Fall prevention is critical for our aging population, and exercise has been shown to help decrease fall risk factors. By using differential air pressure and the AlterG, geriatric patients are able to exercise comfortably and safely. If they have arthritic joints, they no longer have to be limited in their activity levels. If they are deconditioned, the AlterG provides them a fall-safe environment to increase their exercise tolerance. The AlterG can serve as a wonderful motivational tool for obese patients. By exercising at their target body weight, people can experience the difference on their lower extremities with the perceived weight loss from the differential air pressure and the anti-gravity treadmill. A lot of cardiovascular patients also battle musculoskeletal issues. These problems limit their exercise ability, putting them at risk for further cardiac issues, high blood pressure, and metabolic diseases like diabetes. With differential air pressure and the AlterG, problems like osteoarthritis and other joint issues can be taken out of the equation. That way, these patients can focus on getting their exercise, getting fitter, and getting healthier. Thanks for joining me for this brief introductory video. I tried to give you some ideas of how the AlterG can help you and your patients. I showed you some basics of the anti-gravity treadmill and our differential air pressure technology, and you can apply it to your rehabilitation programs. Stay tuned for more videos from us in the future. If you got any questions, don't hesitate to look us up at www.alter-g.com. So until next time, defy gravity and defy your expectations.